So many of the companies, if not most of the companies you're hearing from today, are selling their products and trying to help large enterprise customers. And that's always a challenge. Really slow sales cycles, often conservative buyers. That timeline, that time horizon can be death to a startup. But you know, sometimes the ground changes, things shift, and all of a sudden the marketplace is cracked wide open. And that's the case now where this next issue you're going to hear about is very much top of mind for pretty much every hospital in the country. So please welcome Aircare.
Thanks for that introduction, Elliot. My name is George. I am co-founder and CEO of Aircare, and I'm very excited to share with you today our vision of reducing readmissions. Readmissions is top of mind for every single hospital right now, and it's one of the highest priority IT spends. We are solving this problem through telenursing. So readmission is when a patient leaves a hospital and is back within a specific period of time, typically 30 days. It's a big issue right now because 20 to 30% of all Medicare patients are back in the hospital within 30 days. And Medicare is penalizing hospital up to 3% of Medicare revenues or up to 32% of hospital profits for these high readmissions. In addition, Medicare is also penalizing hospitals for quality or value-based purchasing penalties for a combined potential profit impact of 54%. But wait, there's more. Private insurance companies are increasingly not paying for readmissions. When you add together the profit impact of private payers not paying, Medicare readmission penalties, and Medicare quality penalties, you have the potential to wipe out hospital profits. It's not just about penalties, though. Right now, insurance companies are on the hook for preventable readmission costs. But in an era where more and more hospitals are taking on more and more financial risks, they have to take on their share of the $31 billion in preventable readmission costs as well. Preventing readmissions, though, is not a big mystery. Preventable readmissions boils down to three things: education, adherence, and access. Education is important because when patients leave the hospital, they may not know what are the right steps they have to take to prevent a readmission. Adherence is important because even if they do know, they may forget to take their medications. They may forget to follow their treatment protocols. And last but not least, for those patients in trouble, getting access to a clinician early and quickly is very important in preventing that actual readmission. Right now, hospitals use a combination of in-person visits as well as telephone follow-up calls to reach the entire patient population. This approach is manually labor-intensive as well as very, very expensive. And that is why we created Aircare. So Aircare is a web and tablet solution to address education, adherence, and access to provide low-cost, portable, and best-in-class standard ways of addressing readmissions. We worked with our partners at the Hospital University of Pennsylvania to create a solution that's been workflow optimized with real nurses and real doctors so that pre-discharge, nurses are able to customize checklists for patients. At discharge, patients take home a tablet that's free where they fill out the checklist for 30 days. And after discharge, nurses are able to get notifications for the high risk of readmission patients that have been risk segmented into red, yellow, green statuses. Family members are also able to be involved. My dad may not want to take his medication, but if I find out that my dad's in the red status, I will call my dad, and my dad will take his meds. In addition, nurses are able to follow up with patients who are at high risk directly into their homes through telenursing video consultations. This is what the nurse view for Aircare looks like. By pressing on one single button, nurses are able to pull up a template list of questions for different diseases like heart failure, heart attacks, pneumonia. They're able to customize these questions through drag and drop. And when patients fill out these questions on a daily basis, as you can see in the top left, in the left-hand side of the screen, patients are automatically risk segmented into red, yellow, green status. So instead of following up with the entire patient population, nurses are able to follow up with the high risk of readmission patients. Family members are also able to receive notifications through both text and email. And again, for those patients that are not doing well, we're able to initiate telenursing video consultations directly into patients' home on their tablets. We're very proud to announce that we've launched a pilot with the Hospital University of Pennsylvania's heart failure floor with Dr. Joyce Wald, who's head of their heart failure task force. We're doing product tests and usability tests with cardiologists from Penn Presbyterian. and we're in advanced pilot negotiations with Pennsylvania Hospital. But one of the things that we found is as word started to spread, other departments gave us emails, calls. We received a lot of inbound interest from other departments, including oncology, neurology, neurosurgery, and GI surgery to use the Aircare platform to solve readmissions, but also as a more general telemedicine platform as well. We have the team to execute on this vision. I have both a business background in healthcare and technology. My co-founder, Rushio, has a computer science background. He graduated from IIT #1 in his class at age 20 and went on to MIT where he studied machine learning algorithms for healthcare. We have 2 nurses on our team, Molly, who's a PhD candidate at the Penn Nursing School, and Stephanie, who's an MP candidate at the nursing school. And last but not least, Lily is a software engineer in our team with prior background at Yahoo. We are closing a $1 million round in Q3, Q4 of this year in order to pursue some of these other opportunities and more paying customers as well. In addition, we are looking to grow the team as well as we pursue some of these other opportunities. So we are Aircare. We are solving readmissions through telenursing, and we're looking forward to speaking to many of you after the presentations. Thank you.